Today we have a two-parter, again, like last week, and we decided to switch the order up a little bit. The first speaker is going to be Dan Weiss, who's going to be talking about some of the amazing work that's going on over at Chaminade.
I'm honored to be speaking with you all. I'm going to talk to you about one of my favorite things to do, which is teach palliative care nursing. The other favorite thing I do professionally is I'm still a practicing palliative and hospice nurse after more than a couple of decades of doing this. I'm going to introduce you to ELNEC because I am a certified ELNEC I'm not a trainer of trainers, but I've been through the 2-day train the trainer course a couple times, and I'm going to do a pediatric train the trainer course on the Big Island in April 20th and 21st. So you don't have to be a nurse to attend, but it is a nurse-centric curriculum that was developed in collaboration between amazing researchers and educators at City of Hope outside of LA and the American Association of Colleges of Nursing. They've been teaching some iteration of this curriculum since 2000, and they have really, they've continued to upgrade the curriculum. It's all evidence-based with scholarly research that is fairly current. Since its inception, ELNEC has educated almost 1.5 million nurses in all 50 states and 101 countries. So the curriculum has been translated into a lot of languages. I just found out after through some emails that there are a number of ELNEC courses in Japan. I was teaching. This is presentation that you're looking at is the tail end of a presentation I did for nursing students and faculty at Tokyo Healthcare University 2 weeks ago today. About 46,000 of us have completed at least one of ELNEC's 2-day train the trainer courses, and it's just a great destination to be with some of the top palliative care educators in the country. You can see the number of undergraduate and graduate schools of nursing that are using or have used either the undergraduate curriculum or the graduate curriculum. And Relias LLC is an online learning platform that ELNEC uses. Relias offers many other courses. I've been teaching this for taught the ELNEC curriculum to mostly undergrads, a little bit to nurse practitioner students at Cal State San Marcos for 7 years before I moved here last July. And then beginning in August, I have the pleasure and privilege of teaching this curriculum at Chaminade. Okay, there's a FYI about Japan. So here's what's been going on at Chaminade. I was brought on to basically introduce ELNEC to our School of Nursing students and faculty. And beginning in the fall semester, we started incorporating the ELNEC undergraduate online modules in our complex care nursing courses, which it's a fancy education speak name for our 3 medical surgical nursing courses in sequence. The first 2 modules are taught in the first course of the sequence, then modules 3 and 4 in the second course in the sequence, and modules 5 and 6 in the third course in the sequence. This being my second semester at Chaminade, I am now teaching modules 1, 2, 3, and 4 to 2 different classes this semester. And this summer, we will have modules 5 and 6 introduced. Each of these online modules that ELNEC has are asynchronous online, followed by a 10-question post-test. And they take roughly an hour for the student to complete. Some a little more, some a little less. And the student can download and print or save a certificate of completion for each module. It is helpful to nursing students for several reasons. Number one, the ELNEC curriculum prepares nursing students for roles, what we call primary palliative care nursing. So primary palliative care are non-specialists who incorporate the principles, the knowledge, and the skill set of palliative care in every aspect of healthcare. So it's not only a good idea, it's now a requirement for schools of nursing to teach this, rather than try to invent a basic undergraduate curriculum. ELNEC has prepared this fantastic curriculum. It's very it's priced very affordably. The students can access all 6 modules for a 12-month period for $29. Beginning this year, we will incorporate the ELNEC graduate modules in our Doctor of Nursing Practice program. That is an asynchronous online program with students both in Hawaii and on the mainland attending, with the exception of a couple of immersion courses that last, I think, 3 consecutive days at the beginning of the calendar year and during the summer. So our DNP program it's in its second academic year. Our Dean, Roberta Haley, introduced the Doctor of Nursing Practice degree program to Chaminade when she arrived here about 3.5 years ago. Currently, there are 3 tracks to our DNP program: family nurse practitioner, psych mental health nurse practitioner, and executive leader. The first 2 of those tracks are, you can go straight from a BSN to a DNP in approximately 3 academic years. And the executive leadership is a post-master's program. I think that may be a 2-year program because they already have one graduate degree. And coming soon, I don't think it's been officially announced, but I'll mention that we are working on a pediatric nurse practitioner track as well. Chaminade is very committed to meeting the workforce development needs here in Hawaii. And everyone who works in healthcare here, which I assume is just about all of us, knows that there's a shortage of generalist providers and specialty providers across the state. So hopefully most of the people who obtain their Doctor of Nursing Practice degree at Chaminade will start their clinical practice in Hawaii, but there's no guarantee of that because we do have some NP students from the mainland. All of our bachelor's students who are pre-licensure program will get their are certainly eligible. They're eligible to sit for the national nursing boards, and we hope and pray that most of them will choose to remain in Hawaii. Beyond the scope of this presentation are the reasons why health professionals don't stay in Hawaii. I'm not going to attempt to tackle that. Ask the governor and the legislature to maybe try to fix that problem. The last thing I want to say about palliative nursing education, well, 2 things. One, we're the first of the 8 pre-licensure schools of nursing in the state of Hawaii to incorporate the ELNEC modules into our curriculum. Hopefully not the last, but we're hoping that our sister schools, our sibling schools across the islands will also see fit to start using the ELNEC because it is an American Association of Colleges of Nursing requirement to have. It's one of the 4 pillars of the new essentials in nursing education that the AACN puts out every few years to include palliative and end-of-life nursing education. If that weren't enough, our dean, Roberta Haley, has tasked me with developing a new palliative care minor for undergraduates, which we're hoping to roll out the first in this 5-course sequence this coming fall semester. And I'm hoping and praying that I'm really looking forward to teaching it. These are courses that I've been designing, but they're that are much more in-depth. 3 credits is approximately 135 hours of coursework. So 45 hours per credit at Chaminade. I think I've said enough. I just want you to know that Chaminade is really excited to be offering this curriculum, both the ELNEC curriculum, which I teach it by leading in-class discussions using prepared discussion prompts that ELNEC provides. So ELNEC has done most of the heavy lifting with regard to developing, designing, and producing that curriculum. I just have the pleasure of teaching it. And anyone who's interested in the just Google ELNEC, and it's not too late to register for the 2-day course, April 20th and 21st, and at the Waikoloa Beach Resort on the Big Island. Hope to see some of you there. A few of us from Chaminade are going to be in attendance. Any
Dan,
questions?
Thank you very much. Sorry, didn't mean to interrupt you.
No
Thank
worries.
you. I was thinking too, what you could do is put your email in the chat.
I will be happy to do.
Then people can contact you for further, for other.
And if I'll also put, if I can swing it, I'll put a link to the course brochure. If anyone feels so inspired, it's well worth the time and the expense. And you can get a whole bunch of nursing continuing education hours, or now it's called NCPD, Nursing Continuing Professional Development. It's a new acronym, but it's basically what we need to get 30 hours of every 2 years to maintain our nursing licenses. Thanks for your interest and attention, and spread the word about palliative nursing education at Chaminade.
Great. Well, thank you, Dan. And, kudos to Chaminade for being the first school of nursing to do this in the state.